Assalamualaikum, salam sejahtera. Saya Syabzan Johari dan ini Bisnes Alternatif. Hari ini kita akan bincangkan mengenai satu bisnes baru, iaitu menyediakan pelan kesihatan atau perkhidmatan kesihatan kepada rumah anda, dan kita akan tanya sama ada ini satu orang kata bisnes yang praktikal atau tidak. Saya bersama Managing Director dan juga CEO Love on Wheel, nama perkhidmatannya yang dimiliki oleh syarikat Healthcare Services yang berhad, Mohan Kumar. Welcome to the studio.
Thank you.
Love on Wheel started 3 years ago.
Yes.
Right? And so far, how do you see the response?
The response has been fantastic. I mean, this is something new in Malaysia. Actually, it's new in this part of the world. Mobile healthcare is a unique concept of bringing medical care to the comfort and convenience of a patient's home. It's part of the healthcare delivery system and an integral part of achieving better health.
What area do you cover?
Currently, we're covering the Klang Valley.
Right.
A concentration of patients on the Klang Valley from Ampang as far as Klang, Banting.
All right.
And our plan is to roll out nationwide. That's lots of calls coming from outside the Klang Valley as well.
So basically, the modus operandi, or the operation is, you have a team of nurses, of therapists. You have doctors as well, right?
No, we have. We don't provide doctor service, but we have a clinical director who takes charge of the strategy and medical policies in the organization. We have a team of medical professionals consisting of nurses on the nursing side. On the rehabilitation side, we've got physiotherapists, we have occupational therapists, and in the process of bringing in psychologists as well.
And they were sent, or they were driven, or they ride motorcycle to the patients' homes.
Yes, we've got a lot of young and energetic people, people with us who are ready to go, and they go on motorbikes, they go on cars. Sometimes they even use the LRT to get to the closest destination the quickest as they can. And I call them the A-star team. They're a great team.
I read this biography written by Tun Dr. Mahathir, Doctor in the House, during his early days during his earlier days in practice. He used to walk from to the patient's house. So this is what we want to revitalize, to create the to create this environment where a patient could receive treatments in their own bed.
Yes, that's exactly what we're doing. Of course, during Tun's time and today we're in the 21st century, the traffic scenario in Malaysia has changed. It's not possible to walk anymore. Neither is it convenient to get through the traffic jam. Today, why mobile healthcare has come to stay in Malaysia is basically it's convenience. It's easy. Here you get professionals coming to your home to provide nursing care, provide rehabilitation for a stroke patient, for example. Today, the convenience that we bring is, if you're going to go to a private medical center, if you need to go to a hospital, wherever that is, you have to get through the traffic jam. It's time, it's opportunity cost for the person or the family or the caregivers taking the patient to the hospital. It's waiting time in the hospital, so you spend half a day gone. Here we come in, we set an appointment with you, we come in say tomorrow 10 o'clock, we come there, we prepare a care plan, we have the doctor's referral letter with us, so the continuity of flow from the doctor saying what the patient requires. We reconfirm that, we do a physical examination of the patient, and we start.
I see this as very convenient to patients who can't leave the bed. But how about the other kind of patients, maybe kids or working people like me? Do you come to the office?
Yes, I think this is something very new in Malaysia, to start with mobile health care, number one. Number two is we are now going to corporates, because there are busy people like you who spend almost half the day, more than half the day, maybe spending 18 hours in office. And you say you have a back pain or you've got a neck pain, it's quite natural it comes with your job, standing most of the time, sitting on the table or looking at the laptop. And you can't go because there's work to be done. Your boss is not going to be very happy if you leave the office, and loss of productive time as well. So we come to the office, we fix a time, we come to the office, we need a place to do the physio for you, get the neck pain off your back, and that's something which we have introduced.
But how feasible is this business? I mean, currently, is this service we call covered by the insurance?
Okay, how feasible this is, how practical this problem is?
It's very practical, but I mean, in business-wise,
today, the insurance industry does provide a limited healthcare coverage in terms of home healthcare, which needs to be where ad hoc approval is required from the industry. The industry doesn't have a product at this point to cover home health care. But say if you're hospitalized and the doctor recommends that you require home health care, then insurance industry is looking at it to provide that cover.
And I understand you told me earlier that few corporations like Tenaga.
We have got Tenaga National, which is a GLC, which is providing medical benefit under part of the employee benefit program for their staff. There are a large amount of retirees in Tenaga National, who are lots of them who have got health challenges as well. We have got SOXO on the return to work program, where they've engaged us, and whereby SOXO members can get treated by us. We do it at their home, where if the person requires physiotherapy, for example, or requires occupational therapy, we even go to the factory, we even go to the office.
So basically, those are not who are bed struck. That's what I call it.
Bedridden.
I'm sorry. Bedridden. Those are not only bedridden, but it's everyone who
it
needs.
Could be a preventive thing as well. It doesn't mean you have to fall sick in order to get to require that treatment, or you can be proactive, whereby where there are certain symptoms and it needs to be attended to.
Mohan, have to take a break for a while, and bila kita balik nanti kita akan bercakap mengenai bagaimana kita nak kembangkan idea Love on the Wheels ni ke seluruh negara, dan bagaimana kita memastikan Love on the Wheels ni dapat melestarikan perniagaannya. Jumpa selepas ini.
Ada yang sedang memerhati. Jun ini di Astro Box Office Movies tayangan hebat. Kisah silam bakal menghantui di setiap penjuru. Tiada belas bagi yang bakal bersiksa. Ghost, hubungi sekarang untuk melanggan.
Dasar MBM MBI adalah satu inisiatif Kementerian Pelajaran Malaysia untuk menambah baik pendidikan negara. Dasar MBM MBI diperkenalkan bagi melahirkan murid yang cekap berbahasa. Penambahan masa bagi kedua-dua mata pelajaran telah ditetapkan. Hasrat dasar MBM MBI adalah untuk melahirkan murid yang dinamik serta mampu bersaing di peringkat antarabangsa. Untuk keterangan lanjut, sila layari laman web yang tertera.
Kembali dalam Bisnes Alternatif, masih bersama kita saudara Mohan Kumar. Okay, you are planning to enroll this throughout Malaysia. How do you do that? Next, what's next after this?
See, what we're basically doing now is to develop the infrastructure in order for us to roll out. So we're making a lot of investments in information technology, developing a proprietary software which will enable us to link throughout the country.
So you can share the database.
Yes, we can. Right. It's a web-based kind of system whereby the clinical staff will be able to report online to us. Say, for example, they are in Ipoh and they'll be able to do an online reporting to us wherever they are, maybe even from the closest Starbucks after visiting a patient.
Okay, so now you covers Klang Valley and quite a lot of places in Selangor. Right.
Yeah.
So when is this service going to be available in Penang, Johor Bahru, Melaka?
The plan is to be to do a nationwide rollout or a phased rollout over the next 24 months or next 36 months. This is in tandem with the demand. We are getting a lot of calls coming from outside the Klang Valley. We get calls coming from Penang. We get calls coming as far as Kota Kinabalu for services.
Okay.
But as I said, we need to get an infrastructure in place in order to be able to support the activities that are going to take place on the rollout.
You mentioned earlier there's quite challenges. I mean, for instance, the insurance company, the things that they've covered quite limited. So do you see this as a challenges? And moving forward, as you are growing your business, how are you going to manage these challenges?
I think I've repeatedly said in many of my interviews and opportunities that I had, the insurance industry will definitely have to look at this very seriously, because there's a need. There is a service that's already available.
Yeah.
And it's a win-win situation for all. Healthcare costs is escalating. It's going up every year. And insurance industry will have to look at how they're going to manage the premium. Hospitals will have to look at how they're going to manage the fee structure. And Love on Wheels, the mobile healthcare service, is definitely an option. It's a most cost-effective option. Insurance industries will have to come out with a product that can cover not only hospitalizations, what they're doing now, probably an extension of the policy to cover home healthcare. And that is something that we're looking forward that it will happen. It's happening. For example, today in Europe, 90% of home healthcare services are covered by insurance.
All right. You mentioned earlier, you mentioned just now about cost effectiveness. How's your fee? Is it competitive, comparable to the clinics?
Well, we compare ourselves with hospitals because the clinics as such just don't do physiotherapy services, for example. We are doing what the hospital does. What we do is more maintenance type of thing. We don't do acute care. Acute care is confined to the hospital. So in terms of costs, when you look at cost today, if you get hospitalized, for example, what's your room cost today? Your room cost could be 250, it could be 1,000 ringgit if it's a suite. Right? If you come to your house, that cost is zero. What you're going to pay for me, pay us is just a professional service charge, which is nothing very much. It could be 100 ringgit, 150 ringgit, depending on the type of treatment, the frequency of treatment, the duration of the treatment.
And then you have been operating since the last 3 years. How about the ROI so far?
Well, this is actually our third year of operation. We've just finished 2 years. We broke even on the second year of operation. With the grace of God, I hope we will be able to pay dividends to our shareholders.
Yes, of course. Thank you very much for sharing this with us, Mr. Mohan Kumar. Dan sebelum kita berpisah, ini dia encore kita malam ni.
Thank you.
If you don't drive your business, you'll be driven out of business. Ini datanya daripada Forbes. Dan terima kasih banyak kerana sudi menonton Bisnes Alternatif malam ni. Saya Syafzan Jawari. Jumpa lagi pada minggu depan. Bye. Thank you very much.
Thanks very much.